The United Nations Development Programme in South Sudan joins the rest of the globe in observing the 2024 World AIDS Day. On this day, we remember those who lost their lives to the disease and show solidarity and support for people living with and affected by HIV. The theme of this year, Take the Rights Path, points to the need to eliminate norms, laws, policies, and practices that punish, stigmatize, discriminate, and limit access to essential HIV services to sections of the population. It calls for an inclusive and right-based approach in the HIV response and the need to promote health for all by protecting everyone's right. Central to this theme is a recognition that ending AIDS requires that we reach and engage everyone who is living with, at risk of, or affected by HIV. These include the most vulnerable populations who are often excluded, marginalized, and are affected by punitive laws and policy barriers that limit access to HIV prevention, testing, treatment, and care. Let's all work towards ensuring that HIV programs and services are accessible to all who need them. Under the auspice of the UNDP Global Fund programs, the South Sudan AIDS Commission takes the lead in redressing norms and practices, policy and legal barriers to the provision of HIV services to key and vulnerable populations. I salute the South Sudan AIDS Commission and a network of civil society organizations for the relentless work in increasing awareness, overcoming bottlenecks, and creating the space for the provision of HIV and health services in the country. Important strides have been achieved, including high-level, targeted advocacy and sensitization targeting political leaders, policymakers, legislators, law enforcement, religious leaders, and community members on curbing stigma and discrimination and training healthcare providers in stigma-free care and human rights. A total of 245 hospitals and health facilities, including some in prisons, internally displaced people, and refugee camps, offer HIV and TB services through the UNDP Global Fund program. Out of the estimated 140,000 people living with HIV, about half are diagnosed and on treatment. Yet, HIV/AIDS is still a public health concern in South Sudan. 8,100 new HIV infections were recorded in 2023, representing 675 infections per month. 5,657 HIV/AIDS-related deaths were recorded in 2023, which represents 471 deaths per month. Together, we can end AIDS if everyone's rights are protected.